Over to you, David. Why?
I think there's a pragmatic side to this, essentially. We're not obviously supporting all the strikes. We're not supporting all the strike because we're certainly not supporting the rail strikes and the postal strikes and things. But in the case of the nurses, there's an enormous amount of public sympathy for them. There's a feeling that their wages have been kept down unfairly over the last few years. And of course, a lot of these people were actually the genuine heroes of the pandemic, whatever we think of various parts of government policy and so forth. So that's why we're supporting it. But I should say, there's a difference between saying they should get 20% or 19%, which I'm not sure we're fully behind that. But what we're saying is that there needs to be a pragmatic solution to this. The government needs to sit down with these people.
I suppose, David, the other side of the equation is that the average pay of a nurse is around £34,000 a year, which is well above the sort of average wage in the UK. The government has agreed to the pay review body's recommendation on their pay in full. The government have increased funding for the NHS by 40% in real terms since 2010. And frankly, the government really hasn't got any money. So when you put all of that together, is it really justifiable for them to be going on strike for more pay?
Well, I don't think we're particularly happy about them going on strike, I have to say that. But what we're saying is that the two sides need to sit down and rattle out a solution on this. I mean, we have a genuine health crisis going on. We have a massive waiting list, partly thanks to the 2 years of the lockdown. We can't really have a situation where that just grows and grows and grows. People's lives are at stake, literally, on this. And there needs to be a pragmatic solution on it, and there needs to be a sensible outcome.
David, I know